The HRSA audit experience can be extremely stressful for health centers. What can be really helpful is having a partner there with you through the entire process. Our team has been through numerous HRSA audits before, and what we can do is come alongside you through the entire experience from the time you receive your HRSA audit letter, helping you prepare your data submission, and being there with you through the entire audit experience, including the day of your audit, helping you navigate so you have your most successful audit experience possible.
HRSA will request a number of items from your entity. One of the most important items that they will request is your policies and procedures. You want to review your policy and procedure, make sure that your entity is doing what your policy and procedure states, and that you are aware of what your policy and procedure says you are doing. They'll request a narrative of your entity. They will also request all of your 340B drug utilization, from clinic-administered drugs to contract pharmacies, as well as in-house pharmacies. They will also request 340B purchase records. This is a good time for you to visit the 340B PVP website to see what your historical purchases are, and make sure that anything listed on that report you have auditable records for. HRSA will require a Medicaid billing form for each site that you are carving in Medicaid. It is important to look at the billing form to make sure that the correct NPIs that are associated with your sites are listed, as well as any Medicaid billing requirements for your state. How can we help? Our team offers HRSA audit support during the time of your HRSA audit. If you reach out to us, we will help you from start to finish. We help with compiling all the data needed to upload to HRSA, as well as supporting you through the site visit of your HRSA audit.
So we've talked a little bit about preparing for a HRSA audit, but what happens when the auditor is either on site or it's the day of the audit and you're doing a remote site visit? This can be a high pressure situation because now you've submitted all your data, you've got your samples, but it is time to actually go through the audit process with the auditor. So you are live and prime time. First thing you're going to do is have your team in the room for opening conference. This is an opportunity for your leadership to be present, meet with the auditor. The auditor will set expectations for the day, and you will have an opportunity to highlight your organization and the 340B program. One thing that's really nice to do at this part of the audit is talk about the value of the 340B program to your organization and how you use the savings from 340B to help your community. So if you have services that 340B is supporting, really make sure that you showcase those. For instance, if you're using 340B funds to support helping manage the opioid crisis in your community, or if you're using it for a food pantry to help support your community, make sure you talk about that. We're seeing more and more that the Office of Pharmacy Affairs is very interested in how covered entities are using the 340B savings to meet program intent. Once you're through the opening conference, the auditor is going to start asking you clarifying questions. They're going to want to know more about your program and inquire about areas that may not have been as clear in the documents that you submitted. So there may be follow-up questions on your policies and procedures. They may inquire for more detail on how your contract pharmacy programs are set up, your in-house pharmacy programs are set up, your clinic-administered drugs. They're definitely going to have questions about your billing processes to make sure that you're complying with the Medicaid duplicate discount requirement. And they will also want to talk to your credentialing department to understand how those processes work, as well as talk to your billing department and understand what safeguards are put in place at the system level to make sure you're in compliance with the 340B expectations. From there, the audit is going to go into sampling. And so typically there's approximately 60 samples that'll be selected from your 340B universe. The auditor is going to go through to review that to make sure that each of those claims is 340B eligible. What that means is that they're making sure that there has not been any instances of diversion or duplicate discount that has occurred. What is a 340B universe? A 340B universe is just the way that HRSA describes your 340B utilizations. So if you're using 340B medications in your clinic, that's one 340B universe. If you have an entity-owned in-house pharmacy, that would be considered another 340B universe. If you have contract pharmacies, that would be considered a third. So it's a different term for what we're very familiar with, which is just where are we using our 340B drugs. Once the auditor understands your 340B universes, they'll select samples from each. For each of the samples being reviewed, the auditor is going to go through and test both for diversion and duplicate discount. For diversion, they're looking to make sure that the individual is your patient and 340B eligible. So they're looking to make sure that they can see that you have a record of the care with the patient, that they're established with your health center, that you can show that it is either your provider who delivered care to the patient or that you have some other relationship with the provider that is prescribing the medication, example, a referral for consultation, and that you are able to demonstrate that you have ongoing responsibility for care for the patient. The second test that they're looking for is to make sure that you are in compliance with the Medicaid duplicate discount requirements. So making sure that you have not received a 340B discount when the Medicaid fee-for-service program has also received a rebate. So for each claim that they go through and do their review of, they're testing both of those components. So it's really important that you make sure that as you're going through and doing your internal audits, that you're testing for diversion and duplicate discount on a regular basis to make sure that you're HRSA audit ready. An area that you can be prepared for a HRSA audit well in advance is managing your contract pharmacy agreements. Each time you receive a new contract pharmacy agreement or an update to your contract pharmacy agreements, it's really important that you retain those in your auditable records and that they're readily retrievable for the event of a HRSA audit. When you register a contract pharmacy on OPACE, there is the potential that you may actually have a desktop audit right at that point in time, where the Office of Pharmacy Affairs will request from you documentation to support that registration. And in that process, what you'll need to do is provide them with the fully executed copy of your contract with the pharmacy, and that contract needs to be signed by both parties, dated before or on the day you registered your pharmacy, and show the address of the pharmacy that you are registering and the information of your covered entity or your health center. So that's a simple audit that would be just of that specific pharmacy. But in the case of a full HRSA audit of your 340B program, what the Office of Pharmacy Affairs will expect to see is all of your contract pharmacy contracts. They will expect to see all of the documents fully executed. So the beginning contract that you first signed by both parties, and then at minimum, the most recent amendments that list all of the pharmacies that are registered on the Office of Pharmacy Affairs database. The other piece that's really important is that your contracts either need to list out all of your covered entity sites that they include, or have language that states that the contract applies to all of the locations included within your health center. Because of the maintenance that's required for updating each of the sites within the contract, we highly encourage you to have all-inclusive language saying that your covered entity is fully included within that contract, and then you're simply required to maintain your pharmacy locations as they change. HRSA audits are a stressful time, and covered entities should not have to go through them alone. We're here for you to help you through the process, whether you want a consult call just to learn more about what a HRSA audit looks like, or you've got your letter and you need somebody to assist you through. Reach out to us at FQHC340B.com and we're happy to help.